My name is David Wortley. I'm a Vice President of the International Society for Digital Medicine, which was established in China in 2016. It's my pleasure to talk to you today about the future of digital medicine in the metaverse age. The first point that I would like to make is that the metaverse, although it's extremely a hot topic today, it's not a new concept. In fact, we were exploring the potential of the metaverse for a range of applications in 2007, when Linden Labs had a virtual world called Second Life. And in this virtual world, you were able to conduct things like virtual tours and simulations. And I've shown on the screen here some examples taken from Second Life round about 10 to 15 years ago. So back in 2007, it was being used for medical training, hospital tours, simulations, things like disaster management, emergency treatment, a whole range of different educational applications. If we fast forward now to 2022, our modern times, it's become more sophisticated. It's still providing the same kind of training experiences, but with a higher level of fidelity and the ability to incorporate haptic devices and to add realism. It's also now incorporating augmented and mixed reality, which blend the real world with the virtual world. And I've shown some examples on the screen there, ranging from hospital operations, which with the training simulation, holographic images, which can be presented actually doing real life operations so that you're blending the real and a virtual world, and augmented reality, as you see the example on the far side with a doctor examining a patient, and what she's seeing with her glasses is an overlay onto the real world patient. And today, it's also possible to stream live operations in virtual reality to global audiences. And companies like Medical Realities and surgeons like Professor Shafi Ahmed have been streaming live operations to audiences wearing virtual reality headsets, which can even be something like a Google Cardboard headset. So that's where we stand today. What do we like to see in the future? Well, I think one of the biggest areas for metaverse in digital medicine is for actual diagnostics and treatment. So going beyond just training and education, using the 3D visualization from things like real-world medical scans to talk to patients, collaborate with other kind of surgeons in pre-op and even during the operation status. Also, we are starting to see in the digital therapeutics field the use of the metaverse for actual therapeutic applications, rehabilitation, both mental and physical rehabilitation. I've shown an example there with an application called TRIP, which is available within the metaverse, also available as a mobile application. But its idea is that you can immerse people within virtual environments, and this will help with problems like stress management. And now when you can incorporate these also with wearable devices, you're able to provide feedback to the metaverse that allows you to, in real time, modify the experience that users are having within these virtual metaverse worlds based upon their physiological responses. And the latest iteration of these is a product which is due to be launched next month. It's called MindPlay, and it uses sensors, a little band that you wear on your head, and this measures your brain waves, and it uses these brain waves to help you train your level of concentration and relaxation, and even use this to control electronic devices. So we are in for an exciting time over the next few years, and The metaverse is still, although it's been around for 15 years, it's still at an embryonic stage as far as virtual reality, augmented reality, and mixed reality is concerned. So thank you very much for listening to this presentation, and I hope you have a very enjoyable conference. Thank you.